So we use in one system I was at a clinical database. So we were able to take that database, stratify it as best we could by race, ethnicity, some by language, and began to build the case of what inequities cost the system. It could be in readmissions. It could be in post-surgical complication. It could be with falls with injury. It could be with hospital-acquired pressure injury. So you begin to take those data that systems are required to report anyway and begin as best you can, because you don't want to get paralyzed in analysis, but take that just enough data. And what I did is meet with the chief financial officer and say to him, this is how much pressure injuries are costing us. This is how much readmissions is costing us. This is what poor maternal health outcomes is costing us, just first of all, in real dollars. So I would say for a chief equity officer, the chief of patient safety and quality should be your best friend, because there you can find out, well, what are the events? What do the harm events look like? What are the sentinel events? What are the root cause analysis on safety events telling us about how our system is operating? And more than once I've had events come to me to be analyzed when the teams know that, again, bias or prejudice or racism was a root cause, right? And then what are the behaviors inside of a system that we're not addressing? That goes to the chief financial officer and to some cases the chief nursing officer to say, we know based on our patient experience data that people are leaving our systems because of unprofessional behaviors, for example. That is a cost to us. Not only is it a cost in real money, it's a cost in our reputation. If people say, don't go there, go here. Don't go there because they don't have proper interpretive services. Go to this place because they do have proper interpretive services. All of that becomes a cost. The next one I urge chief equity officers to look at is, what is your malpractice claims? Who is suing you for malpractice? And begin to understand that that's a cost to the system. Once again, in real money, in time, in resources, that is costing the system. So all of those things as a chief equity officer, you need to begin to kind of triangulate all of that to build a system of equity and to say, what are those inputs and what are the outputs and how are we going to build the system in a resilient way?